Welcome back to Get Healthy with Dr. Cooper. Today our topic is cardiovascular disease, the #1 killer in the world and in the United States. However, you really don't have to die from this disease. I have a special guest in my studio today. He's board certified in heart disease as well as obesity. Dr. Pedro Mego. Doctor, welcome to Get Healthy with Dr. Cooper.
Thank you, Dona. Thank you for having me here.
My pleasure, Pedro. Can you tell us a little bit about yourself?
Sure. I am originally from Peru. I did medical school at San Marcos University, and then I trained internal medicine in New York and cardiology and interventional cardiology in Arkansas.
Very good.
Before coming and practice here in South Texas.
How long have you been here in South Texas?
Incredible, since 2005.
Wow, that's a long time. I came here in '96, so I beat you to that. Doctor, I know you have a very busy practice, right? Cardiovascular disease. Why is it so busy here in South Texas?
Yeah, we have been blessed. We have a very busy practice. Probably like most of our people knows, is South Texas and McAllen has been found to be the city, one of the most city with most obesity in the world, and that increased risk for metabolic syndrome, diabetes, and that increased risk for coronary artery disease, and probably that is one of the, and providing good service to our patients, that is in combination with that, we have a very busy practice.
I like the last one, providing good services to your patient.
Absolutely.
You're smart. All right, doctor, heart disease. Tell me a little bit, what is coronary artery disease really?
Coronary artery disease is called ischemic heart disease. Like probably we know, the body has the heart as a pump. Mm-hmm. The main function of the heart is to pump the blood from the heart to the body, but the pump per se, the heart per se, has their own circulation. Mm-hmm. When these arteries to the heart get obstructed, it's called coronary artery disease. And unfortunately, this is significantly common, and unfortunately, this is the #1 cause of death in America and in the whole world.
That's right.
Unfortunately, and probably we're going to talk a little more about that, is the prevalence in South Texas is very high.
Right. So what are the risk factors? You said the prevalence is high here. Why is this so?
It is well known that diabetes,
mm-hmm.
hyperlipidemia, hypertension, smoking, age, family risk,
right.
sedentary lifestyle, obesity, renal disease has significant impact as a risk factors for coronary artery disease. And unfortunately, all of these risk factors are very high here.
That's right. So our listeners that are probably watching us, they might be wondering, do I have heart disease? What are some of the symptoms, doctor?
The most common symptom, the symptoms depends on the stage of the disease. Mm-hmm. If it is an early stage, we are asymptomatic.
Right.
However, if the symptoms are present, means that person most likely has already moderate disease or even advanced disease. The main common symptoms are chest pain, especially related to exercise. If somebody could walk 5 blocks before and now hardly can walk a block or 2 blocks, and this is, they stop because of chest pain. In the way, that is a very strong alert that they could have coronary artery disease. Shortness of breath, reduction in functional capacity are the other symptoms related to this.
So doctors like myself, internal medicine doctors, family practitioner, we send our patients to you. When you get to our patient, what do you do with our patients? How do you make the diagnosis?
Basically, we evaluate the patient, the risk factors, the symptoms, and if we find that they have significant risk factors and symptoms, we evaluate it with a stress test. That's the most common test, how we evaluate it. If the patient can walk and run, we make them walk and run fast as a protocol. If they cannot, we do a chemical-induced exercise. It's called a nuclear stress test, basically, if they are not able to walk fast enough or we estimate that they cannot walk fast enough. That will give us, if abnormal, will increase significantly the chances that they have coronary artery disease. Other tests could be exercise or chemical-induced with echocardiogram, or another one could be a CT scan, what is a CTA, a coronary CTA, with calcium scoring as well can give us a close estimate of the coronary circulation.
But the definitive diagnosis is made by your left heart cath, right?
Basically, the gold standard.
The gold standard.
Gold standard for coronary arteries is made with
So you brought us some pictures. We're going to walk over here. We're going to look at the normal coronary, and then we're going to look at the abnormal ones. So we want our producer to put on the normal coronary, right? Because a lot of patients get scared. They say, oh, I need to go to the cath lab. And they get scared. Should they be afraid of the heart cath?
I don't think so. Coronary artery disease per se is a low-risk procedure. No? It's a procedure that has less than 1% complication risk. Majority of the doctors do it from the groin. I usually do it from the wrist. And with that, I can get access to the arterial system, advance the catheters to the heart, and inject some iodine contrast. And with that, I can visualize the coronary circulation.
All right.
And according to what we find, it depends what we are going to do.
All right, so let's put on our video for the normal cath so that our audience can see what the normal looks like and what the doctor does to relieve the stenosis. All right, so we're going to get it. There it is, doctor. It's right behind you.
Basically, this is almost normal because we're rarely doing a normal patient, but some patients, even having what we call abnormal stress test, the coronary arteries are not that bad.
That's right.
No? For example, this is the right coronary artery. There is a little lesion here if you go in detail comparing to the normal side. In the heart, there are main three arteries. No? Okay. Two coming from the left main, the bifurcation in the left circumflex, and the left anterior descending artery in the front of the heart. And the one that we saw initially was the right coronary artery. Basically, this has minimal obstruction, only mild irregularities. For this patient, is good news. Only we need to continue controlling cholesterol, diabetes, hypertension, antiplatelet therapy, but we don't have to do any intervention for him.
And lifestyle.
Lifestyle, very important.
Right.
Very important. Treat overweight, treat obesity, increase physical activities progressively as much as tolerated.
And the diet is important.
Like probably you have mentioned strongly enough, our diet is the #1 cause of our overweight and obesity.
There you go.
And we need to work on that.
Very good. Let's move to the next one. I think the doctor has some more.
Both of these cases has been done this week. If you have one before this, I think, in this one, for example, this is the left anterior descending, and here, this artery should continue all the way here. But you can see it's obstructed.
Yes.
No, and this actually is my wire that I am trying to cross this area of 100% occlusion.
Right.
If you can go to the next one.
Go to the next one.
I think this is the original one. If you can see it, this artery, it gets obstructed here 100%.
Yeah, you're losing it there.
Here, you don't see it anymore, and this artery should continue there. This is my wire that now is in the apex, in the distal part of the heart. Now I put a balloon, and this is when I am inflating a stent, where it's a small metallic piece that keeps the artery open. In the past, we used to do only balloon angioplasty, then we did just with metallic, but now we have a medicated stent. No? Like you can see this stent here, and now the artery goes all the way to the apex.
So you opened this.
I opened that artery.
Fantastic.
You know? Yeah. And this is a patient, for example, that came to the hospital with chest pain, shortness of breath. Actually, we already knew that this one, another cardiologist did it and was obstructed in 2015.
Wow.
And I mean, with experience and some techniques, we are able to open these arteries, even if they were obstructed 100%.
Wow.
He was considered a poor candidate for bypass at that time, and they said with medication, but he was not doing good with medications, chest pain. In this patient, he's doing fantastic. His benefit, he has already noticing benefit the day after.
That's right, because now we have the blood flow getting from the origin down to the muscles, because you opened up so the flow can get there. So his pain should have improved.
He was very surprised when the next morning he could walk outside the room with no chest pain, no shortness of breath, something that he didn't experience for years.
Good, doc. And I hope you counseled him on lifestyle.
Very important, like no more emphasis. I will never get tired to emphasize the importance of improving our diet, like probably we know 80 to 90% of the problem with obesity is not a lack of exercise, it's our diet.
That's right.
And we need to improve that even more than doing exercise. Improving our diet is the main factor to have a better weight.
That's right. Studies have shown that the #1 risk factor for chronic diseases, diabetes, obesity, heart disease, and cancer, it's the food you consume. So doctor has just showed you how he treats coronary artery disease. However, if you have heart disease, and even though you have a stent or a bypass, but if you continue to live the same lifestyle, you're still overweight, the blood sugar is not controlled, the blood pressure is not controlled, you're eating a lot of fat, a lot of fried foods, you're going to block up the coronaries again. So you have to ensure that you take good care of yourself. Doctor, is there any last minute word you want to say to the viewers?
There is no, it is very important that at a certain time in your life you need to put emphasis in your health. And this time, the best time to do it is now.
That's right.
Not yesterday, not tomorrow. Let's do it now. You didn't do it yesterday, do it now. And emphasizing trying to do a healthier lifestyle, improve your diet, try to get into an exercise program, and consult your family doctor. No? And if your family doctor recommends you to be seen by a cardiologist, follow that advice. And here in South Texas, we would love to take care of you.